Good afternoon. I'm Bijan Kimyagar, Associate Executive Director for Research at Citizens Committee for Children of New York. For those of you joining us for the first time on one of CCC's webinars, welcome. A brief introduction to all of us at Citizens Committee for Children. We are an independent and nonpartisan child advocacy organization. We combine public policy research and data analysis with citizen action to engage policymakers, service providers, and the public at large to promote practical solutions that ensure every New York City child is healthy, housed, educated, and safe. Today's webinar is a resource for anyone and everyone working to address the needs of children and their families during the ongoing response and recovery from the COVID-19 pandemic. Data have been at the forefront of our understanding and decision-making to prevent the spread of the virus, as well as address the economic crisis affecting families in New York City. Importantly, data have also been at the center of our advocacy as we confront racism and other forms of discrimination that are at the root of the inequities of people's lived experiences that we see in the data. Our online database, which you may explore at data.cccnewyork.org, is home to hundreds of indicators of child and family well-being in New York City. Whenever possible, we disaggregate these data, not just to understand the trends and phenomena, but to take action to improve the conditions children and their families face. You will see from these data on our database that even before the pandemic reached New York City, that 400,000 children lived in households with incomes below the federal poverty level, and an equal number lived in near poverty conditions. These data must move us to take action at all levels of policymaking, federal, state, and local. I want to remind all of you who joined us that while you will be muted during the presentation portion, you are essential to the conversation. Please put your thoughts and comments and your questions in the chat or the QA form, and we will try to get to them. And if we don't, we will definitely follow up via email after today's session. I also encourage you to join our e-action network to receive updates on our ongoing analysis of the data from the Household Pulse Survey specifically, as well as many more resources, and engage with us on social media, either on Twitter, Facebook, or Instagram, all at the same handle, CCC New York spelled out. Let me introduce you to Jack Mullan, who will be presenting CCC's analysis of data from the Household Pulse Survey. Jack is a research associate on the research and data analysis team. He is responsible for the collection and analysis of census, administrative, and community-based data that goes into CCC's research products and publications. He has a background in policy analysis and strategic advocacy in a variety of settings. And prior to CCC, he was based in Dublin, where he conducted statistical research on working conditions and labor policy for the European Union. He also brings experience in direct service provision and advocacy at local nonprofits, as well as academic research at the Center for Intersectionality and Social Policy Studies. Jack holds a degree in political science from Vassar College and another in public policy, jointly awarded by the Institute of Social Studies in The Hague and the Institute for International Studies in Barcelona. Jack, I leave us in your very capable hands.
Thank you, Bijan. Of course, I had to unmute myself first for that introduction. And thanks to all of you for joining us today. As Bijan laid out, during the pandemic, CCC has really been committed to monitoring the well-being of families and children in order to identify the immediate needs, but also to push policymakers really to deliver the necessary resources that are needed right now to overcome the impact of the pandemic, as well as its attendant crises, which we'll be touching on today too. So as Bijan said, as always, we rely on the Keeping Track database for a lot of this information. But in the midst of such an unprecedented moment, new instruments of data collection have arisen that we can look to as well. And one of these is the Household Pulse Survey. So in this vein today, I'm going to be sharing information on an analysis on the US Census Bureau's Household Pulse Survey. It is my hope that this presentation can help shed some light on the scale and scope of the impact of COVID and reinforce the need to intervene and act on the present risks to New York City's families and children. So before I jump in, just to note that these slides will be made available in a follow-up email, along with this recording, if you'd like to review this presentation on your own time. I hope you're all able to see my screen as I go through these slides, but of course you can use the chat if you have any technical difficulties throughout. So as we dive into this survey, I want to start with just a message up front that in order to demystify the impact of COVID-19, we really should not lose sight of what we already know. There might be this feeling that the virus is a smokescreen, that because it is such a uniquely challenging time, our ability to identify challenges is somehow obscured. And of course, the longer term impact of the pandemic will obviously take more time to manifest. But I think that when the dust settles, the landscape of multiple crises that we already had known about will remain. And CCC has pointed to some of these crises both prior to and throughout the pandemic as critical to understanding the present moment. So I'm going to go through some of these that CCC has outlined so far. These include systemic barriers to healthcare and safety net programs, particularly for New York City's non-citizen population. There's persistent segregation in our schools along lines of race, ethnicity, English language learners, and students with a disability, and obviously its attendant residential segregation. There's the stratification of the labor market, in which the unequal representation of different demographic groups by industry places certain communities at greater risk of exposure to the virus on the job, as well as risk of employment loss right now in the current recession. There's obviously the immense demand for accessible childcare, accessible not just in terms of transportation and traveling to these sites, but fundamentally in terms of cost. There's the growing need for mental and behavioral health supports, especially growing needs among youth, and the critical role of community-based organizations or CBOs in filling the gaps where community needs go unmet, and also developing asset-based approaches to community development and growth. We also addressed some of these domains in a recent analysis from the American Community Survey from data from 2019. So this was prior to the outbreak of COVID-19, but in a fact sheet and an op-ed, we addressed how these data from 2019 illustrate many of the precursors that shape the present challenges. So our analysis actually looked at how a decade of rising economic inequality in New York City created a number of vulnerable conditions for children in low-income households. These are risks which COVID has deeply exposed right now. So you can access this analysis along with a series of blogs and briefs and the accompanying op-ed at this blog series link below, which we'll of course share in the aftermath of this presentation too. So I bring up these factors because they're still here. These analyses that we put out spoke to many existing crises that predated and now pervade the present moment. COVID-19 obviously does not exist in some abstract universe. Its impact on different aspects of child and family well-being will be mediated and transformed by this pre-existing array of problems. And CCC has observed that the last few months have really reinforced many of the crises we already identified. So I'm going to take a few slides now to go over a few technical notes and of this household pulse survey. So as you may know, CCC relies on a number of surveys to collect and analyze data on families and children. Many of these come from the United States Census Bureau. And in the midst of the pandemic, the Census Bureau launched a new experimental data product called this Household Pulse Survey. It is a 20-minute online survey designed to be quick and efficient, collecting data on a range of ways in which people's lives have been impacted by the pandemic. So the work of developing the survey, brainstorming began in late March. The first phase of data collection initiated roughly a month later on April 23rd and continued on a weekly basis for 90 days until July 21. Summary tables of the data began being published in May, as well as public microdata. These are files that are anonymized of all the responses so that data analysts like myself and my colleagues at CCC can access this to draw out more detailed statistics, which I'll be sharing today. So as I said, the initial scope was 90 days, but as the pandemic has persisted, the Bureau decided to sustain data collection into the fall and recently concluded a phase 2 collection of data collection from August 19th to October 26th. And as the pandemic is reaching another wave across the country, the Bureau I know is looking to continue data collection into 2021, but this has not yet been confirmed as far as I know. So just again, a few technical notes on what this experimental data product is. It is, to be clear, not the decennial census, and it is not the American Community Survey. It is similar to the census in that it is a snapshot survey. It is capturing data for a point in time from week to week, rather than over an entire year like the American Community Survey does. Unlike the census though, it is not trying to capture the entire population. It is not reaching every single household, but instead a sample from which we can draw representative estimates for the adult population 18 years and older. Data are available and representative at the national, state, and MSA level. What is MSA level? This is the Metropolitan Statistical Area. These are areas delineated by the government as having at least one urbanized area with a minimum population of 50,000 people. Our MSA is the New York, Newark, Jersey City Metropolitan Statistical Area. You can see on the map on the left here, it encompasses not just New York City, but stretches out from Long Island to Westchester, Rockland counties, to most of Jersey, and even a sliver of Pennsylvania. As of 2019, it was the largest MSA in the country at nearly 20 million people. But just a note that this collection of people from the sliver in Pennsylvania did not meet a minimum population threshold for this survey. So here on in, when I refer to the New York metropolitan area, that is all those people represented here in the New York and New Jersey encompassing boundary. Finally, here's a sense of what was asked in the questionnaire. I'm not going to go over every question, and you'll get a better sense of them as I go over the findings. There's roughly 50 questions, and you can see they cover a variety of domains of interest to CCC, including economic security, food, health, housing security, and education. This was truly a cross-cutting collaboration. It was not just a matter of the Census Bureau, but also its partner agencies like the Bureau of Labor Statistics, the National Center on Health Statistics, and many others who contribute to different questions in this domain, in these domains. And as well as slate, you'll see a slate on the right of demographic questions, which will obviously be presenting some breakdowns in the data as well. So as I said, just to note that this is a survey of adults aged 18 and older. So the data are not tracking anything specifically on children themselves. There are no statistics on issues like child welfare cases, children in temporary housing, or after school or summer programming, which are areas that CCC is typically focused on. But there's certainly plenty of information you can find both on our database and plenty that I'll be sharing today from the Household Pulse survey. So the survey is reaching roughly 2,500 adults living in the New York metro area each week. And I'm going to go over the findings now from the first phase from April 23rd to July 21. I combined multiple weeks of data here, and we'll be sharing findings mostly from this aggregate period from April to July because it is not a very large sample from week to week. I'll also be reporting the margins of error, which are high in some cases when you start to dig into these demographic breakdowns. So without further ado, let's get into CCC's analysis of the data. Starting with economic security. So we've seen plenty of work emerge over the last few months, which is captured here on the left of this slide. This includes from the Center for New York City Affairs, from the Center for an Urban Future, each of whom have analyzed the extent and scope of job losses in New York City, particularly in the city's immigrant communities, which we're going to be touching on from the data here, and research from the Center on Social Poverty and Social Policy at Columbia University, which highlighted the critical anti-poverty impact of the stimulus check and unemployment benefits from the CARES Act. So the Household Pulse survey in this regard includes questions about income loss, the reason for being out of work, and the receipt of the stimulus check and week-to-week spending habits that were included from June onward. From the data, here is the key takeaway in terms of economic security. More than half of all adults in the New York metro area report a loss of employment income since March 13th. In each week of the survey, we can see that this is greater than the income loss reported nationwide, roughly equivalent to that reported statewide. And then I also note here that you see on some of these purple dotted lines, even as New York City has phased in the reopening of businesses, this very high level of income loss has persisted. Over this aggregate period from April to July, about 57% of New Yorkers report a loss of income. If we break this down by demographic groups, we find that households with children are even more likely to report a loss of income, 62% of whom, adults living with children, report a loss of income. And then among households with children, the income loss is greatest among Hispanic Latino adults. There are about 3/4 of whom report income loss, and low-income adults. It is really low-wage working families who are experiencing a profound economic crisis right now. Those who are in households earning less than $25,000 a year, 80% of whom report a loss of employment income since the start of lockdown in March. Now, when we look at why people are out of work, obviously COVID-related business closures are a big factor, especially in New York, but the demand for childcare is also reflected in these data. So the chart on the right here shows the reasons why people report being out of work. And COVID was obviously the biggest factor. This chunk in red indicates that about half of all New York adults report being out of work due to business closures or someone being ill at home due to COVID. But among adults living with children, this stacked bar all the way on the far right here indicates that 13% reported that they did not work in the last week because they were caring for children who are not in school or daycare. So for more than 1 in 10 unemployed adults, childcare is the primary barrier for returning to work. Now, further, when we exclude those who are retired or not seeking work, the imbalance between employment and childcare clearly shows that the burden is falling disproportionately on women. From April to July, about 20% of adults between the ages of 25 to 44 have cited childcare as the primary reason for their lack of employment. And if we break this down by gender, almost 1 in 3 women have cited childcare as their primary barrier to employment, compared to roughly 10% of men over the same time. Now, from June, the Household Pulse survey began tracking household spending habits. The data suggests here that it is again low-income households who are in desperate need of economic relief just to get by. Here is a breakdown, this chart here, breakdown of the source of income by household income level. And we find that a quarter of those in households making less than $25,000 annually report relying on borrowing from friends and family. So again, we see in the data this surge of mutual aid networks and support from neighbors and community level organizations. And another 23% were using unemployment benefits for spending needs, more than any other group on the income spectrum. Obviously, a key part of the CARES Act was the boost to unemployment assistance, but that has expired months ago, back in July, and we are now in October without a renewal of that assistance. So moving on to food insecurity, I'm sure many of you know, if you're speaking to service providers right now, that the demand at food banks and pantries right now is simply overwhelming. The Household Pulse survey does allow us to track food security with a pair of questions on household food insufficiency prior to March 13th, and then in the past 7 days, over the course of the pandemic. Now, I just want to note a little bit in the weeds here, but the way that the question is framed can result in different metrics of food insecurity. And here is where the Department of Agriculture usually asks a series of questions regarding food access, food affordability, and food sufficiency to construe an indication of food security. But given the constraints of this quick turnaround operation, the Household Pulse survey just asked 2 questions that pertain specifically to food insufficiency. So if a household member reports that sometimes or often they're not having enough to eat, they are considered to live in a food insufficient household. So by this metric, the change in food insufficiency before and during the pandemic has not been significant. It is just outside the margin of error, from about 13.3% to 14.7% in the New York metro area among households with children. Nevertheless, this is a very high share of households who are food insufficient. About 1 in 7 households with children who are saying that they have sometimes or often not enough to eat on a weekly basis. Now, in the later weeks of the survey from June onward, the Census Bureau introduced an additional question about the children's food insecurity, which I'll go into now. This question asked the extent to which it is true that children were not eating enough because we just couldn't afford enough food. The chart on the right here plots children's food insecurity for the period that the question was asked, as I said, from June to July. And the findings here really mirror the data on income loss, in that it is adults living with children who identify as Hispanic or Latino, or those who are living in low-income households who report the highest rates of children's food insecurity. And I want to make a shout out here to my colleague, Alice Buffkin, on the policy team, who has gone into the state of food insecurity in a detailed blog on CCC's website, which we've linked to in the slide earlier. To reiterate one of her points, these numbers reflect some pre-existing patterns that were born out of inequities, like, for example, the quote-unquote chilling effect that discouraged many low-income immigrant households from receiving or participating in safety net supports like food stamps. So we may suspect that higher rates of children's food insecurity among Latino adults living with children may have to do with this barrier. These numbers could also be much worse were it not for the emergency food support infrastructure in the city. In the next slide, I show that hundreds of thousands of adults report receiving free meals and groceries on a weekly basis. So these bubbles here represent the share of households who say they received a free meal or grocery in the past week by the source from which they received this support. Among households with children who reported receiving this free support in the past week, most are likely to get help from schools or programs for children, family, friends, and neighbors, and religious organizations. So these orange circles here indicate that more than a quarter of households with children report receiving free meals. They got them from either schools or neighbors. And the weekly average is presented here on the right in the column that more than 200,000 adults living in the New York metro area reported receiving school-based food supports on a weekly basis. Now, onto health, and obviously indicators of health are very relevant in the midst of a public health crisis. But the data on general health do not tell us maybe a new story, I would say. CCC was collecting annual data from the Community Health Survey run by the Department of Health in the city, which measured respondents' self-rated health on a scale from excellent to very good to good or fair or poor. The share reporting on the lower end of that spectrum, fair or poor, in New York City was about 23% as of 2017. So we can compare this with the latest data from the Household Pulse, which shows it's actually a slightly lower percentage, about 1 in 5, 18% in the New York metro area, a broader geography, who say they have fair or poor health. But of course, there are these really significant disparities by demographic groups. So we see that lower self-rated health is highest among those identifying as Hispanic Latino, those living in low-income households, and those adults without a high school diploma, 40% of whom have said they experience fair or poor health. The Census Bureau also borrowed from the National Health Interview Survey to introduce a few standard questions to monitor adults' mental well-being, and these involve the PHQ-2 and the GAD-2. These are questions that ask respondents to share the frequency with which they felt, you'll see here, having little interest or pleasure in doing things, feeling down, depressed, or hopeless, feeling nervous, or not being able to control or stop worrying. Now, based on these responses, we can gather a sense of what are associated with clinical symptoms of depression and anxiety disorders. The latest data from the NHIS from June 2019 estimated about 11% of US adults reporting symptoms of anxiety and or depression. The number from the Household Pulse survey is triple that. It is 35% nationally and 41% in the New York metro area. Reported symptoms of anxiety and or depressive disorder are particularly higher among young adults under the ages of 25 and 35. Again, this split across demographic groups is not entirely a new phenomenon, as with general health, but we know that given the overall rise in symptoms of anxiety and depression, youth are at an alarmingly higher risk. So in this latest period from June to July, almost 50% of youth ages 18 to 24 in this New York metro area reported these symptoms of anxiety and or depression. Now, the Household Pulse survey conceived these questions on mental well-being as a tool for monitoring it amidst the pandemic, but the recent experiences of police brutality and anti-Black racism on display across the country may have also opened a window into using the survey to track mental well-being in another way. One point of relevant research I want to lift up here is a 2018 article in the medical journal The Lancet, which found, the authors here found a significant negative spillover effect on the mental health of Black Americans in the aftermath of police killings. So the authors used data from another survey, the Behavioral Risk Factor Surveillance Survey, and found that in the month following a prominent police killing of an unarmed Black American, Black residents living in the same state where it occurred reported significantly higher rates of poor mental health days, whereas this effect was not registered among residents of other racial ethnic groups. So considering this method in a similar fashion, the Household Pulse survey reveals that reported symptoms of anxiety and or depression spiked across all racial ethnic groups in the weeks following the murder of George Floyd on May 25th. These are figures for the adult population across the entire country. And the figures here highlighted in orange red show that non-Hispanic Black adults went from an average of 16% reporting these symptoms to 40% in the month following from May 28th to June 23rd. Now, this is a very provisional finding, and I don't mean to suggest anything conclusive here, but I do want to elevate this as something to keep in mind going forward as we consider appropriate supports and responses to the mental health needs of children and youth, particularly Black children and children of color in our city. So I'm going to touch briefly on housing security now and then finish with education before wrapping up. And of course, I appreciate all the questions coming in and the eagerness to discuss a lot of these findings, which we'll get into after that. So some ongoing surveys of landlords, this one here from the CHIP, Community Housing Improvement Program survey, back in May found that about 25% of New York City's renters had not paid rent in prior months. Our peers at the New York University's Furman Center have also released a few analyses illustrating a vast need for housing subsidies and support for low-income tenants. The Household Pulse survey asks two fundamental questions in this domain: whether respondents paid the last month's rent, and whether they have confidence in meeting the next month's payment. So the story here is one that resonates with the emerging data elsewhere. About a quarter of tenants in the New York metro area reported missing a rental payment over the last month. Statewide, we can see the share of renters is also somewhere between 22 to 28% who said they missed a rental payment. If we break this down by household type though, rent arrears, that is being behind on rent, is really highest in households with children. 33% of renters with children report missing rental payments from April to July. Now, across demographic groups, a lack of confidence in future rental payments, I suppose you can call this housing insecurity, it is highest among Latino adults and those without a high school diploma, and especially those in low-income households. Now, note here that the margins of error, the confidence intervals, are a little bit broader than I'd like, even using this entire data set from April to July. But we can say in general that about 1 in 5 New York Metro residents living with children reported no confidence in meeting next month's rent. This is really a scale of housing insecurity which we haven't registered in recent memory and is calling out for adequate supports right now. Finally, on matters of education, the Household Pulse Survey contains an array of questions, but I'll admit that significant takeaways so far remain a little bit elusive. The survey asks about the impact of the way children engage in education, the existence of digital devices and internet at home, as well as the hours that students and parents have contributed to remote learning and instruction. Early data on the number of hours that parents have put into assisting their children with remote learning was reported on by the New York Times and mentioned by my colleague, Sophia Halkidis, in our remote learning webinar back in June. These data pointed to signs that children were spending roughly 10 to 15 hours a week on remote learning with family members, and this held true roughly across all demographic groups. But I'm for now going to focus on questions 44 and 46 here on the access to and provision of digital supports. So on the left side of the slide, I've bulleted out that there is a very small fraction of children that report rarely or never having internet and a computer device available at home. This is actually marginally higher among white non-Hispanic children in the New York metro area. This is potentially underscoring data that I've mentioned on a past webinar that CCC carried out in June as well on the digital divide and how white children in majority Hasidic communities, in some cases, lack a digital infrastructure to carry out remote learning. But also a reminder that we pointed to other sources like the American Community Survey. You can find this data on our database, suggesting that about 100,000 school-age children live in homes without any internet connection. Now, in terms of the DOE's response to distribute devices, it does appear that it is having an equitable impact. There are low-income households in the New York metro area who are much more likely to report receiving a computer or digital device from a school or school district. You can see in the chart on the right, in the beige bar, about 40% of low-income households with children report receiving devices from their school. So to summarize what CCC has observed from the survey so far, here are a few important takeaways from the data. We see a profound economic crisis for low-wage working families. More than 80% of low-income families in the New York metro area have reported a loss of income since March. Additionally, the reasons why people are out of work really illuminates the necessity of a robust and secure childcare system to facilitate parents' return to work, particularly insofar as this is a significant labor market barrier for women. Now, on health, about 1 in 7 households with children is reporting that they do not have enough to eat each week. And each week, hundreds of thousands of New Yorkers are receiving free meals and groceries. This is really a testament to the widespread reach of New York City's emergency food infrastructure, especially these school-based supports for families with children. On youth, we focus on the mental health figures here, which really showed a staggering rise in anxiety and depression in general, but particular attention should be paid to youth, especially Black youth and youth of color, who are bearing additional mental health burdens in the current climate of racial injustice. On housing, there is a looming crisis for New York City's renters. I'm not the first to say this, but the data are very plain in that it is low-income renters and their children who are at a significant risk of housing insecurity, eviction, and homelessness. And on the educational data, there are some things to be desired there, but I think it's important to continue to monitor for adequate conditions for remote learning and to ensure that any pre-existing gaps between students do not worsen, particularly for students without Wi-Fi or adequate digital devices. Now, I mentioned there's going to be this phase 2 that has been finished on the Household Pulse survey that wrapped up on October 26. We're collecting the data now. As it has concluded, we will continue to look at how children and families are faring and examining these same questions from phase 1. But I wanted to point to a few newer modifications in phase 2, which we'll also be keeping an eye on, which include the ability to work from home or telework, how families are spending their money and managing in this economic crisis, New questions on the use and the need for behavioral health services, specifically counseling from a mental health professional. And in concert with housing insecurity, there's a new question on the fear of eviction or foreclosure, which is especially important given the level of insecurity we've seen among low-income tenants. And finally, a focus on students' remote learning experience or in-person learning experiences as the new school year has started. As I said, recently the Census Bureau has petitioned to the Office of Management and Budget to resume data collection for the Household Pulse Survey into 2021, which really underscores the magnitude of the pandemic and how important it is to sustain efforts to collect data to understand family circumstances at this time. But beyond our desires to see more data collection, I want to conclude with a few key points for advocacy. Now, CCC is mobilizing around these findings, and we hope you'll join us to advocate that at all levels of government right now, we need to address the immediate needs and support the long-term well-being of New York City's families and children. Obviously, the struggle is immense right now, but there are a few immediate actions that we can take that we believe will chart a path to a more equitable and sustainable recovery. This starts with much needed budgetary relief. New York City and the state are facing multi-billion-dollar deficits in the current year for the state and for out years in the city. How they handle these deficits could well deepen the need and lead to an even longer economic recession. So we at CCC, along with our partners, are focused on securing direct aid for states and municipalities from the federal government in the form of stimulus. It's unclear if the stimulus agreements will be reached before Inauguration Day in January. But above and beyond the stimulus, we believe that tax policy opportunities need to be pursued at the state level and that the city must be granted borrowing authority in order to have the financial resources to protect and expand investments in essential health and human services. Our state and local advocacy is focused on protecting investments in health and human services and responding to increased needs. Some top priority areas include the primary and behavioral health care, increasing access to and equity in telehealth services right now, food insecurity, increasing investment to allow community organizations and these mutual aid networks to address the immense demand right now for food, early care and education, stabilizing the childcare system and expanding access is what we need right now. Remote learning, obviously targeting special populations, above all the homeless, students in temporary housing, students with special needs, rent subsidies and arrears. Obviously, we need to prevent a surge in shelter entry and to stave off an immense rise in housing insecurity as the moratorium on evictions is lifted. And finally, child welfare prevention. So this is flexibility funding from the state that has been leveraged in the past to provide economic stability and support to families, including, very importantly, reaching immigrant households who in many cases thus far have been excluded from government relief. So to wrap up, here are some links for further reading and resources. The Census Bureau created an interactive data tool, which I've left a link to here, which allows you to visualize some top-level findings if you're eager to explore any more of these data. As I said, CCC published a comprehensive array of blogs on the impact of COVID-19 across different aspects of well-being. And you can find our analysis on the economic inequality and the way it has shaped the inequities born out of the pandemic at these two links. As I stated earlier, this presentation will be shared by email in the aftermath. And for any further outreach, I can always be reached at my email listed at the bottom of this slide. And of course, stay tuned because we want you to plug into calls to action on federal stimulus, state and local budget advocacy, and more data analysis and updates in the future. So I want to thank you all for joining me again and for staying informed and continuing the fight for New York City's children. With that, Bijan, unless there's anything you want to add, I'm totally happy to open the floor to questions and comments. I'm also going to leave a link in the chat here to a follow-up survey, which you can respond to let us know what you thought of the webinar. Thanks.
Thank you, Jack. I have nothing to add in terms of content. You really did a great job of painting the picture of what the survey is and what we're learning from it, at least at this point. Definitely follow the link that Jack has shared, and there are a few questions. Jack, feel free to take them as you like, but there is one about the methodology that I hope you can answer, or someone had in the chat, around what is the sample size for the MSA for New York City and perhaps or I should say Metropolitan Statistical Area, and then also maybe like broadly, if you know those numbers offhand.
Right. And I think I made a note to try to mention this at the beginning, but I might have gone too quickly through this. So So each week, as the household pulse survey was going, at least in this first phase from April to July, it was reaching roughly 2,500 adults living in this New York metro area. As I said, it's encompassing not just New York City, but broader counties, Long Island, Rockland, Westchester, and also a lot of New Jersey, Northern Jersey. Among that, it's about 800 who are living with children, adults, households with children who are being reached on a weekly basis. I think this is roughly continued into the fall, although the kind of unit of data collection for the fall has expanded to 2 weeks now. So they have typically had some issues reaching the households they're trying to collect data from. The response rate, I believe, is between 3 to 5%, which is pretty low, but we are keeping tabs on these sample sizes. And as I said, making sure to report these margins of error, just so we have an idea as well of some of the uncertainty that this experimental data product comes with as well.
Great. We're getting some more questions. I'll highlight them because they also relate to the methodology around, is there ways to break down the data by boroughs in New York City? And then there's a specific question around further breakdowns of the rental payment issue. I guess those who are their confidence in paying rent next month. Right. I think for the first one, there's a pretty straightforward answer. And for the second one, there might be something more that you want to add. I'll let you answer them.
Yeah, so on the deriving boroughs from the MSA, the short answer is no. But I would say, as people who are New Yorkers, as people who are very invested in your communities, if you do know some demographic information about the geographical area that you're trying to capture, for example, if you're looking at a community that is predominantly Hispanic or Latino, we can try to approximate some of the findings from this broader MSA about specifically the Hispanic or Latino population, and use that as a proxy for the borough you're trying to cover. Now, I would not say that it's going to be a precise or perfect approximation, but there are ways of trying to work around capturing the communities or the populations you're trying to get data for. But unfortunately, the borough counties are not able to account for it specifically in this survey. Now, on the topic of rental payments, I would actually point to a fact sheet that elaborated on this issue a little bit more recently that we published just this week on family homelessness and housing insecurity in 2020. And I'm going to find a link to that, or Bijan, if you want to try to find a link to that. And
I'd be happy to, yeah.
In this, I went a bit deeper than this no confidence question. As I said in slide 30 here, roughly there was about 1 in 5 households with children in the city, so 20% who said they have no confidence in paying next month's rent. Now, that is one way to look at the question. The question is actually asked on a scale from no confidence to slight confidence to moderate confidence to high confidence, or something to that effect. We actually looked at the percentage of households with children who say they have slight or no confidence. So we might say that they're on the wrong side of the equation in terms of their security in meeting the next month's payment. And one of the key findings from this fact sheet, which Bijan just linked to here, was that among households with children in this lower category of earning $25,000 or less, 2/3, so 66%, said that they had slight or no confidence in meeting next month's rent. So while the number here is 38% for no confidence, if we're a little bit more inclusive of slight or no, that number doubles to about 66% from this April to July period. Now, as I said too, there's also data we're going to be looking at on the likelihood of eviction, which is very much linked to this housing security question.
Jack, we're getting a couple of questions around what questions were on the Household Pulse survey and how they're going to be consistent over time. So one, can you speak a little bit about how the questions shifted, or how you're seeing them shift to the second phase, and what we'll be able to kind of monitor from phase 1 to phase 2? And thinking specifically around substance use disorder, was there anything specific in the survey on that, in addition to the generalized anxiety disorder and other issues of behavioral health?
So, as I said, more broadly, or maybe I'll start with the question on substance abuse and then go broader to the phase 1 to phase 2 questionnaire differences. So on substance abuse, in phase 1, there was no question beyond on behavioral health matters. There was nothing beyond the question on anxiety and depressive disorders. In phase 2, the survey did introduce a few new items related to behavioral health and behavioral health activities. One of them was asking if someone had been taking prescriptive medication over the last period of time. We haven't yet looked into those responses, but there was nothing more specific on any kind of substance abuse disorder or abuse in general of substances. And then, as I mentioned, there is this 2 new questions on the receipt and need for behavioral health services. So these questions in more specific language ask, in the past, I think, week or month, have you sought counseling from a mental health professional, and did you receive it? And if you didn't receive it for any reason, tell us as well. So those are another set of questions that we're very eager to explore as we look into the phase 2 data set. But we won't be able to compare them exactly from April to October, but rather just from this period of August to October. More broadly, there are questions that are consistent. And I would say, like I mentioned at the beginning, there's about 50 questions in total on the questionnaire. Maybe phase 2 has kind of gone up to 60 or somewhere around that range. I would say the bulk of the questions are consistent. So we can look broadly from April to October. And then if the survey is pursued from November and onward, we can probably continue or count on many questions to be consistent as well. Our plans on how comprehensive we decide to be are in process. But obviously, if there is demand out there for this kind of comprehensive look about what the Household Pulse survey tells us over all phases of the survey, we'd be happy to try to pursue that to help people understand. I can answer one quick question I see in the Q&A as well about curious why 50K and 100K isn't included in the income bracket area. This was a personal, editorial choice of mine, just for some of these breakdowns to show in cases where there was significant discrepancies by income level. In many cases, the differences are most stark when you make this cutoff between 50K and below and 100K and above. But we do have the data. The question on income itself just asked people to report from intervals, I believe, of 10 or 20,000. So I was able to construe from those responses these kind of cutoffs, which we typically use because 25,000 is roughly the threshold for the poverty level for a family of 4, 50,000 being those in or near poverty, and 100 and above being kind of 400% and above, so high income. But there were some findings we did find from this 50 to 100K range that would probably merit some further investigation. I do remember one being that many households earning in this range experienced very similar levels of job losses to those earning 25,000 and below. So really, we only saw the relief from economic instability or employment instability at the 100,000 and above. But if you have any other specific questions about this range of 50 to 100,000, I'm totally happy to respond to any requests on that too.
Jack, we're getting a couple of questions around childcare. One is just how do we move from the data to policy recommendations and in general supporting with advocacy for women and families who need childcare assistance. Since we have one of our policy associates, Daryl Hornick-Becker, on with us today, I think it would be good, since this is deep within his portfolio, this topic, if he could speak a little bit to how he's using these data that you have analyzed in the advocacy work and policy recommendations that he's doing. So Daryl, I've unmuted you. Hopefully you can unmute yourself too.
Yep, I'm here. You can hear me?
Yes, we can.
Great. So yeah, I'm Daryl, member of the policy team. So this is a great question. We've really been trying to utilize this household pulse survey data in a number of ways with our advocacy. Related to childcare, the statistic that Jack shared on the number of adults who report loss of income, loss of work because of childcare reasons is a really significant number. With New York, with the New York State and city, the prospect of austerity and budget cuts because of the economic situation we're in, it's really trying to position childcare not as a human service that's needed, but as part of any economic recovery. There is no recovery in New York without childcare. And even if parents aren't enrolling their kids in childcare now, I've heard advocates say just because there aren't fires doesn't mean you don't fund the fire department, right? So we need to support childcare and childcare providers so that parents do have a place to bring kids and get back to work. The different advocacy we're engaging in is both short-term and long-term, state, local, and federal. On the state side, it's about really making sure that the state's properly utilizing federal CARES dollars to help support childcare providers, which they haven't done a good job with so far, but also long-term towards the budget that childcare is held harmless in the face of budget cuts, and also making long-term substantial investments, if not this budget, but eventually into raising subsidies to make it more affordable and accessible. At the city level, again, protecting against cuts. We were lucky to avoid childcare cuts in the most recent city budget, while we sustained cuts in other areas. But again, protecting that capacity, making sure that all our leaders understand its importance in terms of an economic recovery. I think that helps answer the question.
I think so too. And if, just as a reminder, if anyone has any questions, further comments, feel free to write them in the chat or in the Q&A. We were also going to be sending a follow-up email with a link to the slides. And then Jack was also reminding us that we're going to be sharing a link to a YouTube page that has a recording of this. So if you want to share this with other people, as our colleague at the Queen's Library was suggesting she might do, it's definitely something you can do. We have other questions that are coming in, and I encourage all of you to continue asking them and making comments. We really want to know how you are using these data in your own work, in your own advocacy. We very much are integrating it into ours, but we really see ourselves as part of a broader ecosystem of partners working to keep our fingers on the pulse of the household pulse survey, but also make a change in terms of improving conditions that families are facing right now during this time. So continue to share your questions and comments about how you might use this information too. Jack, there's a question here around trauma and the considerations for mental health and the breakdowns that you put together specifically around George Floyd and its impact. Can you talk a little bit about the data on these generalized anxiety or depression, and how you took a look at these and how you put them together to make what I think you were being clear about is, not a definitive answer, but kind of like thinking about what these experiences mean for people's mental health, especially at a point of the time of crisis like we're in.
Right. So as it pertains to trauma, I have to say specifically, I'm not going to use that word because, and even any kind of clinical terminology I would avoid using here, because as Bijan said, this is a provisional finding. But what I did do when I was looking at the questions and responses on mental health, behavioral health, was follow a kind of approach that is taken by the National Center on Health Statistics and this National Health Interview Survey, which I refer to here as a reference point for January to June 2019. These symptoms of anxiety and or depression among adults, the way we construe this indication at 11% in 2019 and what we're reporting nationally from April to July of 35%, is based on a kind of aggregate score that people are assigned to. So over the last 7 days, how often have you been bothered by each of these different factors? If they report a score on a scale that we make, they are typically associated with what a psychologist or someone who is clinically examining someone's mental well-being would assign as symptoms of anxiety disorder or depressive disorder. Now, I'm not saying that, again, this is not a clinical diagnosis of the population, but it is the standard practice that I've found that other research agencies, government agencies use when trying to evaluate mental well-being of a population. And by using this same metric, we see such a stark rise nationally, and then such a stark rise by these racial ethnic groups, which I think really speaks to something foundational or fundamentally, really alarming with these figures.
Thanks for that, Jack. We got another question that related to mental health specifically. And since we have not just Daryl, but also Alice Bufkin, who directs our child and adolescent health policy work, maybe we can hear from you, Alice, about this aspect of the work on mental health under your portfolio. And then also, Daryl, if there's anything you want to add on to as it relates to mental health services specifically that are school-based in the education realm. I think both of you, we've opened up the mic for you.
Sure, thanks, Bijan. Yeah, I mean, I think what we are seeing, and our partners throughout the city and the state are seeing, are the profound effects of COVID-19, and what we're seeing in terms of racial injustice throughout the country, the impact that's having on young people and their families. So in terms of COVID-19, we have children who are experiencing loss of loved ones, who are experiencing, profound economic insecurity, food insecurity, housing instability, who are experiencing social isolation, and who have lost a lot of the connections to the sort of norms and regular activities they have every day, as well as the health and behavioral health services that they might normally have been able to access in person. So we really are seeing sort of this compounding of challenges that are facing children and young people throughout the state. So when it comes to what we can do to address this, we really need to recognize, sort of in keeping with what Daryl said before, the importance of investing in behavioral health supports. This is not a time to be sort of approaching austerity, because we know so many of the aspects of what help support parents and families and children is making sure that they have the income support that they need, that they have the housing stability that they need, that they are having their food needs met. Those are all fundamental pieces of mental health and well-being. And on top of that, we need to find new ways to connect children to behavioral health supports in the community. So that includes clinical supports. That also includes community-based organizations who, remain a really critical source of connecting children to services. And that also includes school-based services. So we're moving to sort of a new telehealth model for many young people. For many, this works really well. A lot of young people, they're used to working through, through the internet or through the phone. They may be more comfortable with that. But we also have a lot of issues around telehealth equity, of wanting to make sure that we maintain these new telehealth modes that can make it easier for families who maybe struggle because of transportation or childcare to get services. But then we want to make sure we're not having a two-tiered system where, some families are able to access in-person services where others are only able to access telehealth services. There's a lot of complicated elements in sort of how we're approaching this, but we know there are models out there, there are providers out there that do incredible work to get services to children. It's really about investing in them and making sure that the full continuum of services are available to as many families throughout New York as possible. So I'll just pause there, and I'll hand it over to Daryl to see if he'd like to add anything.
Yeah, I would just say that in terms of mental health services in schools, this data, we've used exactly this chart on our most recent blog and brief on the impacts and cuts that the state and city and federal budgets are going to have on mental health services in schools. And while we know it's a priority, and while the city and state have stated it's a priority, the budgets don't reflect that. And so it's data like this that uses us to really bring the issue forward, that now more than ever, supports in schools are vital to kids' success.
Thank you both, Daryl and Alice, for adding to this. Really happy that we had an opportunity to hear from you how you're integrating this work already. I wanted to respond to a question here that was asking around, does the work here reflect housing stability, and specifically overcrowded living situations, not good for social distancing, obviously, and moving in with relatives, et cetera, to avoid homelessness? Jack, I can say a little bit about this as it relates to other resources that we have, but maybe you can speak to a little bit more the housing focus. The overcrowding is not a question that's asked here specifically, but Jack has up on the screen some items that we're going to be looking forward in the future. What I've done is dropped into the chat a link to our online database, keeping track online, specifically to the overcrowded rental housing indicator. And here you can explore, for not just the citywide, but also by borough and by community district, the share of households that are severely overcrowded. And also specifically something that we added earlier this year because of trying to understand this during the COVID-19 pandemic and the issue of social distancing by household type, looking at households with or without children. And so this indeed has a profound influence on the spread of a virus and living in overcrowded conditions. So while the Household Pulse survey doesn't ask about it, we have robust data from the American Community Survey from 2019 that we should more or less assume that the situations are as bad as we might expect in some areas where there's severe overcrowding. As much as 30% of households with children in some areas are overcrowded in rental units specifically. Jack, I'll hand it over to you, and for you to have the last word, since we're coming up at the top of the hour. And before I break, I just say thank you to everyone for joining us. Again, we're going to be sending up a follow-up with several links. Thank you to you, Jack, for putting together this presentation that has the details that we're really needing at this time, to Alice and to Daryl for joining in and supporting with the policy ask. Jack, I'll leave you with the last word.
Thanks, Bijan. Just on the final point about overcrowded rental housing, thus far, at least in the phase 1 questionnaire, this was not asked to respondents, but we do know actually now from phase 2, a question about the number of people who live in the home and the kind of apartment, the kind of building it is, were introduced. So we can probably start to dig into these to get answers about, you know, overcrowded conditions over the last few months. But I do think Bijan is definitely on point in alluding to the information we have from 2019. As I mentioned, this is an experimental data product, so it's always important to triangulate or moderate the information we're getting from the household pulse survey versus other sources, which are going on for much longer time. But in general, I would say thanks again for so much to everyone for joining us today. You know, as I mentioned, we're going to continue to pursue analysis of phase 2. And I want you all to stay tuned for much more from CCC, whether it's, you know, joining our e-action network and supporting our calls for federal stimulus and state and local budget priorities, as well as much more data analysis like this to come on the household pulse survey and on many other issues. So thanks again for everyone for taking the time to be with us today, and we look forward to being in touch. Take care.